Hello, I'm Isaiah Neves, and I'm a research assistant with Minds of London Middlesex. We've been conducting research on destigmatization and storytelling, looking at how we can change mental health perspectives through stories. Storytelling is a powerful tool for normalizing the marginalized experience of mental health struggles. Through stories, we can come to better understand the challenges facing those who are managing mental illness, allow individuals with similar experiences to feel seen and heard, and establish a sense of community and connection that can be so significant in combating mental health struggles. This opportunity for meaningful change is often undersupported and undervalued as an asset for mental health, both as a clinical practice in the form of narrative therapy and as a social practice of communal sharing. Our hypothesis is that facilitation of storytelling and support for methods of sharing stories about mental health will correlate with positive mental health and well-being outcomes for individuals who participate. To test that hypothesis, we developed 3 prototypes to promote conversation around mental health and well-being and provide individuals with the tools they need to engage in dialogue. Our first prototype is the Mental Wellness Profile, which is an online interactive tool that allows a user to create a personalized image representing their mental wellness journey. A big focus of the Mental Wellness Profile was the recognition that everyone has an ongoing relationship with their mental health, and that we can all benefit from normalizing self-care and decreasing stigma. The Mental Wellness Profile also seeks to allow a less vulnerable way to share than speaking firsthand about your experiences, which many individuals might not be ready for. The resource will be available for use by individuals or organizations and serve to begin conversations around mental health. Our second prototype is the Safe Storytelling Toolkit, which is a written tool that guides the user through the process of creating and sharing a story. It was developed in consultation with a number of individuals with lived experience sharing their mental health story, and stemmed from a consistently presenting need for such a resource in the organizations we spoke to. The toolkit focuses on asking questions rather than providing answers, guiding the storyteller to critically consider the impact of their story and the safety of both themselves and their audience. The resource will be available to anyone looking to discuss mental health issues and will be integrated into the creation process of existing storytelling organizations. Our final prototype is Unheard Voices, a storytelling event focused on centering speakers who are often not given a platform to discuss their experiences. Our first event was focused on youth voices, and had 2 youth speakers sharing their stories alongside a call to action for change in mental health support systems for young people. Future events will feature other groups of speakers, attempting to promote as wide of a range of mental health conversations as we can. We've integrated our Safe Storytelling Toolkit into the process of preparing the speakers, and are piloting a peer mentor model where an individual who has used the toolkit is able to provide support to the storyteller through the process. The event was a way for us to better understand how we can assist storytellers and receive feedback on our work so far. We've been able to learn so much about how to support and facilitate meaningful dialogue, the responsibility of both the speaker and organizer of mental health focused events, and what it means to work towards creating a safe space. Moving forward, we'll be applying critique to fine-tune our projects, then conducting formal interviews to collect qualitative data. A principle of our lab is research leading to action, so all of our research will directly impact the results of our prototypes and be used to enhance the quality of them. Through our work conducted thus far, it's become clear that there's a strong need for support of dialogue around mental illness and mental health related issues. We hope to be able to not only begin to fill that gap and provide services and resources to empower storytelling, but also to inspire others to do the same. Initial reaction to our research and production has been overwhelmingly positive and really served to strengthen our belief that these types of resources will have a profound impact. We are so excited about the potential of this research to dismantle stigma around mental health, one story at a time. Thank you so much for taking the time to hear about the work we're doing. I hope you have a lovely research day.